If you're over 60, a weak core isn't just about losing strength. It can throw off your balance, may lead to back pain, and even make everyday movements harder. But the good news is that with just 10 minutes a day, you can rebuild your core and strengthen your back, so you can keep doing the things you love. In this video, I'm going to take you through a 10-minute routine. No planks, but simple, science-backed exercises that I give to 90% of my patients. Now, if you want real core strength and back support, you need to target 4 key muscles, especially the 2 that almost everyone neglects. Let me show you why they matter. Think of your core like the trunk of a tree. The outer bark, aka your superficial core muscles, provide some support, but it's the inner rings, your deep core muscles, transverse abdominis and multifidus, that keep the tree strong and stable over time. If the inner rings are weak, which can happen with sarcopenia or with disuse, the tree may look sturdy on the outside, but will struggle to withstand wind, storms, and the test of time. The same goes for your body. Without strong, deep core muscles, everyday movements like walking, climbing stairs, and standing tall become harder and a little bit less stable. But here's the good news. A major study analyzing 20 others found that core strength training significantly improves balance and mobility in older adults. By strengthening both the outer bark and deep inner rings of your core, you can stay strong, balanced, and pain-free for years to come. This is exactly what helped my 70-year-old patient Mary, who struggled with back and leg pain. She went from barely walking 15 minutes to enjoying the activities she loves again. And here are the exact exercises that worked for her, many of them which we'll be doing together shortly. So now that you know why deep core strength is essential, let's dive into a simple 10-minute routine to target every key muscle of your core and back. It's gentle enough for people with back pain, stenosis, arthritis, or degenerative discs. Let's start by lying on your back, on a carpet, a mat, or even your bed. We're going to start with a quick warm-up and core activation exercise that's going to prime us for the rest of the routine. With your knees bent, tighten your core and lift one knee up at a time, alternating like you are marching. We're going to do this for roughly 30 seconds. Ensure your back is flat and tummy is tight. Now, a common mistake I see here is people just lifting their knees using their hip muscle. Rather, focus on tightening your tummy and lift that leg up using your core muscles. You don't have to go far. Stop at about 90 degrees like this and bring the foot back and forth. Continue to alternate at your own pace. Now, this is a great gentle warm-up exercise which improves not only your hip mobility, but also strengthens your core muscles. Let's do 10 together. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. Now we're going to do one of my favorite core exercises that is gentle enough for most older adults, but very effective at building strength when done correctly. From the same position as before, lying on your back, lift one knee up at a time until both shins are parallel to the ground. The key here is to pull your belly button in to activate your core, which will cause your back to get a bit more flat on the surface that you're on. Once you're in this top position, your goal is to hold for 15 seconds. Let's do 5 seconds together right now. 5, 4, 3, 2, and 1. Now we're going to repeat this for 2 more sets. Again, lifting those knees up and holding. This exercise is called the dead bug and is a wonderful deep core and low back strengthening exercise that I give to many of my patients with spinal stenosis, degenerative discs, or just general weakness. Now, ensure you are breathing while you're holding this position. Now, this can take some practice and coordination, but once done correctly, this can dramatically improve your ability to lift and carry, bend while remaining strong and stable through your trunk. Now, before we go to our third and final set, I'm going to give you 2 progressions that you can do as this variation gets easier. An intermediate version is where you lift your knees as well as your hands to the ceiling. This takes away the stability from your arms, which requires your core to work a bit harder. A more advanced version is where you kick your legs out one at a time while keeping your core engaged like this. Let's do one final set together. You can pick any of these versions. Holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Great job. Now we're going to move to an exercise I learned at a back pain clinic, highly recommended by the surgeons for the core strength and the pain relief that comes from it. This exercise is called the modified crunch. Lying on your back with your knees bent and feet flat again, place your hands on your thighs. From here, engage your abdominal muscles, imagining them slightly getting tighter while your low back gets flatter or maybe rounder against the surface that you're on. If you have back pain, this slight movement alone can give you relief. From here, inhale deeply, and as you exhale, lift your shoulder blades off the ground, focusing on using your deep core muscles to curl up rather than pulling with your neck or chest. Hold for a moment at the top, then slowly lower back down as you inhale. Now we're going to finish strong with 5 repetitions together. 5, 4, 3, keep going, 2, and 1. Excellent work. Before moving to our back muscles, let's take a 10-second break by hugging those knees and holding this position. This is called knees to chest. Take some deep breaths here while you just relax your lower back. 5, 4, 3, 2, and 1. Now we're going to target the 2 crucial muscles at the back, the erector spinae, which is more superficial, and the multifidus, which is a little bit deeper. This exercise is easier than you think. Get into a comfortable and stable 4-point position like this, hands right below your shoulders and knees right below your hips. Both should be shoulder width apart. If you are on a hard surface, you may use pillows or a towel under your knees for extra cushion. From here, keeping your core tight and in a neutral position, kick one leg back out slowly. You will feel your glutes and low back working. The key here is to hold for roughly 5 seconds before switching to the other side. Ensure you are not rolling over with your low back, keeping your back straight. This exercise is called the modified bird dog and is fantastic for maintaining a good posture and trunk stability while also helping reduce back pain, especially those with disc-related injuries. Now keep alternating the legs. As this gets easier, which it will, you can do the full bird dog where you extend out the opposite arm. So if the right leg kicks back, lift that left arm up and hold, and then vice versa. When the left leg kicks out, the right arm goes up, holding for 5 seconds each. As you get stronger, you can increase the hold time. So pick any leg and extend out the opposite arm. Hold for 5, 4, 3, 2, and 1, and then now switch. Opposite arm, opposite leg. 5, 4, 3, 2, 1. Great work. Now that we worked out our core muscles and our back muscles, it's a good idea to cool them down with a gentle stretch. You can either go back to the double knees to chest as we did before, or while you are in this 4-point position, you can rock your hips back towards your heels. Gradually slide your hands forward and relax your upper back, neck, and shoulders as you settle into a wonderful stretch called the child's pose or prayer pose. This is a fantastic way to stretch out your entire spine and cool down the core muscles. Continue to hold, taking in deep inhales followed by slow exhales. In and out. In and out. Let's do one final inhale. In through the nose and out through the nose or mouth as you relax. Fantastic work. So now that you strengthen your core, you might still want to strengthen your legs, which are the foundation of your mobility. Click on this video here where I'll take you through a simple 10-minute leg strength routine that is perfect for anyone over 50. And if you haven't subscribed to this channel yet, you can click on this circle here. I'd love to see you back for future videos. Take care.